Okay, so please forgive me for coming in late this week. I have been under the weather, and so I've just kind of been behind a little this week. So my apologies. I am pre-recording this on ScreenPal and then putting it in because I did not have time to do a live lecture and then upload it. So again, my apologies. So we're looking at deliverable 4 this week. We are in week 4. In deliverable 4, we're looking at ways to communicate with our board members. Specifically, we're looking at ways that we're going to be talking to, our board of directors. So you may be thinking, would I ever be talking to a board of directors in the public health sector? Yes, absolutely. Because board of directors, they play a huge part when it comes to nonprofit public health agencies. Their primary purpose is to really provide legal and financial and strategic oversight to any public health agency. They have to ensure that organization acts as a responsible steward along with its mission, and they have to be able to keep up the community's reputation with that agency. Okay, so they make sure that agency stays within legal compliance at all times. And so, they make sure that the agency stays within strategic directions, that they have performance oversight, that they stay within risk management at all times. So every MPH project has got to go through the board because the board has to be able to validate. So when we're looking at that, the board really wants to make sure that they're very mindful, the agency is very mindful, and they care about the impact of that community. So they look at the budget, they look at efficiencies, they look at community health outcomes, and they look at the legal liability. So the assignment in deliverable 4 is really, it's asking you to work with your public health director, and it's asking you to look at a public health policy and to research a current policy that may impact a project that you're working on at your site. So it's saying to research a current policy that may impact a project that you're actually working on, and look at how it's impacting it, and then look at any types of recommendations for improvement, and then draw up an email that you would actually submit to the board of directors to see if you can actually implement some changes to them, or if you can actually put that in front of them, right? So what it's asking you to do is to create an email, and it wants you to summarize a current policy that impacts the project that you're working on at your practicum site. It wants you to include what's the policy. It wants you to know when the policy was established, why it was created, who the target population is. It wants you to explain how the policy has influenced the public health, including the data on how many people were impacted by the policy. It wants you to include the data to support positive changes to the public health. It wants you to include the data that entails the negative impact on public health. It wants you to recommend 3 ways that the policy can be improved to have greater impact on public health. And it wants you to meet the scholarly expectations, which includes the purpose, the style, the format, and the audience. So if you were doing a practicum at a K-12 educational facility, you would be looking at something like national lunch programs. How do we update the 2010, Healthy Hunger-Free Kids Act? Specifically, how do we improve, nutritional standards in Title I schools, for instance? Maybe you're going from, farm to school. How would you eliminate, for instance, reduced price categories, make it free to all? And what if you're trying to remove the stigma of, low income families, for instance? So just make sure that when you're writing these emails, that you are really keeping in mind who you're writing to. You're not writing to a friend, you're not writing to a colleague, you're not writing to a boss. You're writing to a board of directors. You're writing to people who really have the community needs in heart, who really want to ensure the sustainable impact. You're writing to people who, again, they have the budget in mind, they have efficiencies in mind, they have community health outcomes in mind, They have legal liabilities and ramifications of what you're saying in mind, long-term goals, the mission and the vision. We're going to say that over and over because that is so imperative, right? So for instance, if I was an MPH student, and I live in Nashville, I would be looking at like the homeless population of the veterans. And I would also be looking at, not only would I be looking at the homeless population, but I'd be looking at the opioid use within the homeless population. So I would want to do a practical rotation at, say, the VA, Tennessee Valley healthcare system. So as a student, I might want to work with the homeless patients, aligned care team, or the HPAT, and I would look at that homeless veteran care program, and I would want to know like who serves veterans struggling with housing instability, or the PTSD section of that, with substance abuse, right? So let's say that I'm looking at the homeless veteran population, maybe I'm looking at the height of COVID-19 pandemic, 2020 height of COVID-19 pandemic. So my subject line would be policy analysis, impact of 9/11, Good Samaritan protections of National's homeless veterans during COVID-19 or something, right? And then I would go on and I would say, dear members of the board of directors. Now, this is something that I drafted so that I could read this to you to kind of give you an idea. I am writing to summarize my analysis of the Tennessee 911 Good Samaritan law. And then I would state the law, whatever number it is, and its specific impact on the homeless veterans that we serve at the VA Tennessee Valley healthcare system, because I would want to be very specific in the organization and in the section of the organization that I would be at my practicum site in. As we navigate this dual crisis of COVID-19 pandemic and surging overdose rates, I would want to put that in there because I'm doing two things. I'm in the height of COVID, and I'm also looking at the overdose rates that we're in the middle of that with, right? Evaluating this policy is vital for our veteran outreach and PTSD support initiatives. I didn't just say, hey, we want to look at it. We want to evaluate this policy. It's vital. So I made sure to put that in the very beginning. How important is it? It's vital for our veteran outreach and PTSD support initiatives. I wanted to put that in there because remember, the area that I'm looking into, or the area that I'm working with, that whole area is the Good Samaritan protection area, right? So that's the homeless patient aligned care team, and what they do is they absolutely they work with the veterans who are struggling or housing instability with substance abuse, PTSD and substance abuse. So that's why we're targeting this. So I wanted to make sure I put that in there so that my board knows exactly the area that I'm working with and where I'm at, right? So this is the part that I want to put in exactly what I'm at. The law, the section of the law that I'm looking at, and exactly how important is it, and exactly the area that we're working for, right in the very beginning, okay? And then I want to put in the policy. Now I want to put in that policy overview. So I've got exactly where I'm at, and I'm putting the policy overview. So I would come in and I would say something like, the Tennessee, again, the exact law. I'm going to reference it again to keep it in their mind. 911 Good Samaritan law was established. That's the first part of the email, of the directions that we're asking you to do, right? First part was established in 2015 to provide limited immunity from arrest and persecution for individuals who seek medical assistance for a drug overdose. It was created to eliminate the fear of police as a barrier to calling 911. So remember, we asked you, what does it do? Why was it created? Right there. I answered the first two. The target population. Who is the targeted population? I'm answering it right there. The target population is exceptionally broad, but holds particular significance for our Nashville homeless veterans. Many of whom suffer from PTSD and utilize opioids as a coping mechanism for trauma. The public health impact in 2020 the 2020, so this is where I'm going to, I subdivided it for me, so not to tell you about it, but till I can tell you what I'm talking about. So I subdivided this into, so I can tell you exactly where I'm going to. So I told exactly where I was on there. Now I'm going to tell you the impact. Now I want them to know what impact it is that's having it. So why is this important? What is the impact that it's having? Again, remember, all they care about is what is the impact. So the 2020 calendar year has seen an unprecedented shift in our veteran health outcomes due to the social isolation and service disruptions caused by the COVID-19 pandemic. Okay, so I've asked you in the directions, well, the directions are asking you what's the positive impact and what's the negative. So now I'm leading up to it. Here's the impacts. What's the positive impact? Between March and June 2020, Tennessee saw a 33% increase in non-fatal opioid overdoses compared to the same period in 2019. The existence of this law ensured that hundreds of Nashville residents continue to engage emergency services despite the stay-at-home orders. What's the negative impact? In 2020, Nashville recorded 619 fatal overdoses, a 32% increase from a previous year, with fentanyl detected in 80% of toxicology reports. For our homeless veterans with PTSD, this law's current one-time immunity list is devastating. Veterans experiencing chronic relapse, often triggered by pandemic-related stress and PTSD flashbacks, are currently ineligible for protection if they have overdosed previously. I've told the positive and the negative. So now what are we going to do about it? Our board wants to know, okay, so what do you want us to do about it? What else can we do? I recommend the following policies. How can we enhance this policy to make it better? I recommend that we provide immunity for every overdose event. Chronic substance use is recognized medical symptoms of PTSD. Punishing veterans for subsequent overdoses discourages life-saving 911 calls. I recommend that we integrate mobile veteran outreach. We partner with Nashville Vet Center to provide street medicine teams to include peer recovery specialists. These teams can bridge the trust gap between homeless veterans and emergency services during pandemic-related lockdowns. Thank you for your dedication to the veterans of Middle Tennessee. I look forward to your feedback and these recommendations. And then sincerely, your name, MPH practicum student. And then you put the VA Tennessee Valley Healthcare Systems or wherever practicum site that you're from. And that's all you have to do. That is your whole assignment right there. But end it cordially and let them know. So you want to give 1 or 2 recommendations why for the improvement, right? That's all you have to do. But you're meeting all of the criteria that they're asking you to meet. You explain the policy. You include the data of how many people are impacted. You include the positive changes, the negative changes, recommendations of 3 ways. Only gave you 2, just there was 3 in there. My third one was to post-overdose warm handoff. So you would update the policy to mandate that 911 providers provide immediate referral information to mental health resources. So anyway, and to housing support people. But anyway, so beside that, that's what you would do. Okay, so that is how you would do your email in a nutshell. Okay. If you have any questions, so do it about your practicum site. Pick a policy that they had. Look at the policy. Pull the data links from it. Ask people that you're doing your practicum sites with. Ask your supervisors to work with you on it. They can help get data for you if you need to. And then find ways to help enhance it. That's part of the experience that you're at your practicum site. Find ways to do that. And all the stuff that you're working with, if you haven't already done your capstone, all of these things can move into your capstone with you. Not patient identification information, obviously, but all of these can go into your capstone with you, and they can help you with your capstone. And again, my apologies for class this week. I've been under the weather, but we will try to catch up and get that going next week for you. But if you need me, please do not hesitate to reach out. You can catch me by email at any time. Thank you so much. I hope you're having a wonderful week and a great weekend coming up.